Hi everyone, and welcome to another episode of your free consult. I get so many questions about infertility, so this time I'm doing a 3-part series on infertility just to help you understand where the man gets involved, where the woman gets involved, to dispel some myths. I really hope you enjoy this episode, so stay tuned. So first of all, let's understand what exactly is infertility. Infertility is when you've been trying to have a baby for an entire year. So it has a time limit to it, 12 months. When you've been trying for 12 months and you're unable to get pregnant as a couple. And what exactly is trying? So many times I get couples who come to me and say, oh, we've been struggling to get pregnant, but the truth is they haven't actually been trying. Trying means having unprotected sexual intercourse 3 to 4 times a week for 12 months, and then we can say that you have infertility. Now, when you're under 35, we give you 12 months, but when you're over 35, we give you just 6 months before we say that yes, you do have a reproductive challenge. And remember, we can have primary or secondary infertility. Primary infertility is when you've never ever before been pregnant, never had a miscarriage, never had any kind of pregnancy. But secondary infertility is when you've had either a baby or miscarriage or a blighted ovum or any other kind of pregnancy. You've had a pregnancy before and now you're struggling to have another pregnancy. And this is what we call secondary infertility. Now let's talk quickly about what are some of the causes of infertility. Remember, with infertility, because a couple is involved, we have male causes and we have female causes of infertility. Let's start off with the female ones. So the female causes of infertility are related to the reproductive organs, and the first and foremost is the ovary. So with the ovary, one of the causes of infertility can be polycystic ovarian syndrome, or a decreased ovarian reserve, or any other hormonal abnormality or imbalance that causes a woman not to ovulate. This could be a thyroid abnormality. This could be an abnormality in a hormone called prolactin, which women produce when they are pregnant, but some women can produce in very excessive levels even when they're not pregnant. And so any hormonal abnormality that affects your ovary and stops your ovary from ovulating can cause infertility. The next organ we look at is the fallopian tube. So fallopian tubes can either be blocked from a previous infection, for example, chlamydia or gonorrhea, an infection that ascended from the vagina, went up into the fallopian tube and caused it to block. Fallopian tubes can also be dysfunctional because they have spasms or because they have an infection such as tuberculosis, or because they have something called adhesions. Adhesions are when tissues form between other organs and the fallopian tube and cause the fallopian tube to be pulled to a different direction. And what this does is that it distorts the anatomy between the ovary and the fallopian tube, where the ovary is supposed to send the egg to the fallopian tube, where the fallopian tube picks it up. Now, when the relationship between the ovary and the fallopian tube is distorted by anything such as adhesions, blockage, or infection, then infertility ensues. The next organ is the peritoneum. This is the lining of the abdomen. The peritoneum can form many adhesions either from a previous infection or from previous surgery, and that can make the peritoneum stick to other organs inside the abdomen and make other organs stick to each other. And this can cause infertility because everything needs to be in line and everything needs to be able to move freely for your reproductive system to work efficiently. The next organ is the uterus. The uterus can be a cause of infertility either because it has fibroids or because it has something called synechia, which are little tissues that connect to each other inside the uterus, or because the lining of the uterus or the endometrium is not receptive to the fertilized ovum that comes in to be able to implant and have a baby grow. These are some of the causes of infertility that are related to the uterus. The next organ is the cervix. The cervix could cause infertility, especially if it has an anatomical abnormality. What that means is that its structure is not proper, or maybe the mucus inside the cervix is too harsh to allow sperms to penetrate and to be able to cause a pregnancy. And the next organ, of course, is the vagina. The vagina can cause infertility, for example, if it has a congenital abnormality. This is an abnormality that one is born with. The vagina could have a septum or a wall of tissue, either going vertically or horizontally, that could either make sex very painful or make sex impossible, or stop sperms penetrating the cervix and eventually the uterus to be able to cause pregnancy. And remember, you can have infertility from a combination of factors. You don't just have to have one in the ovary or the uterus or the cervix. You can have a combination of issues that cause female infertility. Now, what could be some of the male causes of infertility? One of the reasons for infertility in men is hormonal imbalances. For example, men who have thyroid issues or issues with prolactin where they have hyperprolactinemia. Prolactin is a hormone that's produced in the brain and is produced during lactation, but men have it as well, and when it's in excess, it causes infertility. So thyroid issues, prolactin issues, and sometimes other hormones can cause infertility in men, including insulin, and men who are diabetic could have infertility. Another reason for male infertility is psychosexual issues, and these are possibly men who have erectile dysfunction or any other male sexual dysfunction. Something else that could cause infertility in men is genetic abnormalities. So for example, men who have a deletion of their Y chromosome. We call them men, but actually men are supposed to have X and Y chromosomes, and for those who have a deletion or any other chromosomal abnormality, they could have inability to produce sperms or have infertility. Another reason for male infertility is infection. For example, any man who has testicular tuberculosis or gonorrhea could have infertility, and this could be a reason why they are unable to make their spouse pregnant. One of the other reasons for male infertility is genetic factors. We have some genetic diseases that do not allow men to either form naturally in terms of their male organs or even to be able to produce sperm later on. One of the other reasons is oligoasthenospermia. These are men whose sperm sample shows that they have not only abnormally formed sperms, but sometimes they have actually no sperms or a very decreased amount of sperms. Sometimes the sperms have an abnormal motion or an abnormal structure, and this may not have a reason, a specific reason, but it can cause infertility. One of the other reasons why a man could have infertility is drug-induced infertility, and I'm talking specifically about antihypertensive medication or medication that is used for depression or any other antipsychotic medication. It could not only cause erectile dysfunction but also actually cause infertility and inability to make sperm. So medication and having a medical history with your gynecologist is very important so that your gynecologist may understand why exactly there is the male side of that infertility. One of the other things that could cause infertility is previous surgery. For example, men who have surgery for hernias. A hernia is when the intestines pop into a different section of the abdomen, specifically around the groin area or around the testicles. That's a hernia, and when that happens, it could cause infertility because the intestines are quite warm, and when they descend into the testes, like when a hernia happens, they could change the temperature in the testicles, making sperm manufacture really slow or possibly non-existent. Men could also have congenital abnormalities, and if you saw my post the other day about the patient who had MRKH syndrome, where she had a small uterus and no vagina, men can have similar congenital abnormalities where they have absence of the vas deferens, which could cause them to have infertility. So congenital malformations in men can cause infertility as well. And then of course we have other combined issues such as retrograde ejaculation, men who ejaculate backwards or retrogressively back into the reproductive system instead of outside the reproductive system could also have male factor infertility. So I hope now you clearly understand what are the causes of male and female infertility. I'd like you to catch me in part 2 of this video, where I'm going to be discussing some of the investigations that your doctor may send you for when either you or your partner are experiencing infertility. What are some of the management options for this infertility? And of course, the most important part and the thing that I know you guys want to hear about is in vitro fertilization and other forms of assisted reproductive technology. Catch me on the next episode next week.